Hypothyroidism can affect the body in subtle but impactful ways. Symptoms often appear slowly and can easily be mistaken for other conditions or even everyday stress. However, if ignored, they can intensify and significantly impair quality of life. But how can you tell if you're really dealing with hypothyroidism? In this video, we'll explore 10 of the most common signs that your thyroid may have low hormone levels. These symptoms range from constant tiredness to changes in weight, mood, and metabolism. Keeping an eye out for these clues is key to identifying the problem early and seeking the right treatment. Let's see what these signs are and what they might be telling you about your thyroid health. 1. Fatigue and excessive tiredness. Fatigue and excessive tiredness are some of the most common and debilitating symptoms of hypothyroidism. When the thyroid doesn't produce enough hormones, the body's metabolism slows down dramatically, affecting the body's ability to generate energy. This results in a feeling of constant tiredness that doesn't go away, even with a good night's sleep or rest during the day. This type of fatigue isn't like normal tiredness after a long day. It's a deep exhaustion that can make it difficult to carry out simple activities, such as getting out of bed, working, or even socializing. Some people with hypothyroidism report that they feel as if their body is dragging, even without making any physical effort. The lack of energy affects not only physical performance, but also concentration, mood, and motivation. 2. Unexplained weight gain. When the thyroid produces fewer hormones than necessary, the body's metabolism slows down, which means it burns fewer calories, even if your diet and level of physical activity remain the same. This metabolic slowdown can result in gradual but continuous weight gain, which is often difficult to reverse without proper treatment. The additional weight is largely a combination of body fat and fluid retention, as the body also has difficulty eliminating excess fluids efficiently. The most frustrating thing for many people is that, despite attempts at dieting or exercise, weight gain can persist or even increase. This symptom can be especially frustrating for those who already have healthy habits and cannot understand why they are gaining weight without an apparent cause. If you've noticed weight gain with no clear explanation, this could be a sign of hypothyroidism and should be investigated by a health professional. 3. Sensitivity to cold. The thyroid is responsible for controlling various metabolic functions, including the production of body heat. When there is insufficient production of thyroid hormones, the metabolism slows down, and the body generates less heat than normal. This causes people with hypothyroidism to feel cold in situations where others are comfortable. You may notice that, even on a mild day or indoors, you feel unusually cold. Cold hands and feet, the need for extra clothes, or to cover up even on not-so-cold days, and intolerance to lower temperatures can all be clear signs of this symptom. This discomfort can become constant, affecting daily activities and even sleep. If you feel colder than usual, or if you seem to be the only person in a group who is uncomfortable with the ambient temperature, your thyroid may be working improperly. 4. Dry skin and hair. These are common symptoms of hypothyroidism, resulting from the impact of low thyroid hormone production on cell renewal. The thyroid plays a crucial role in regulating the metabolism of skin cells and hair follicles. When hormone levels are low, the natural cell regeneration cycle is slowed down. This can lead to skin that becomes dry, rough, and flaky, regardless of the use of moisturizers. Some people notice that their hands and feet are especially dry, and in more severe cases, cracking and itching can occur. The same process affects the hair, which can become fragile, brittle, and lose its shine. Hair loss can also be significant, resulting in visible thinning on both the scalp and eyebrows. In addition, nail growth can be impaired, making them more brittle. If you are noticing that your skin and hair are drier and more lifeless, even with proper care, it may be a sign that your thyroid is not working properly and needs to be checked. Before I go any further, if you're learning about the thyroid and want to delve even deeper into its health, check out the video description for my exclusive ebook with valuable information and practical tips to better understand your thyroid health. Also, subscribe to the channel, turn on notifications, and join our community to find out more. 5. Constipation. Constipation is a common symptom in people with hypothyroidism and occurs due to the slowing down of the metabolism, which also affects the digestive system. The thyroid directly influences the rate at which the intestine processes food. When there is insufficient production of thyroid hormones, the natural movement of the intestinal tract slows down, making it more difficult for the digestive contents to pass through. This delay in intestinal transit can lead to hard stools, infrequent bowel movements, and a feeling of bloating or abdominal discomfort. In some cases, constipation can be persistent and difficult to treat with dietary changes or common remedies. In addition, the feeling of slow digestion can become very frustrating and impact on quality of life, as abdominal discomfort can be constant. 6. Menstrual changes. Women with hypothyroidism may experience longer, more frequent, or heavier periods than usual, a condition known as menorrhagia. In some cases, the menstrual cycle can become more spaced out, resulting in fewer periods throughout the year, called oligomenorrhea. In addition, PMS symptoms such as cramps can intensify, making the cycle more uncomfortable. These changes can be frustrating and affect quality of life, as well as reproductive health and fertility. Women of childbearing age may find it more difficult to get pregnant, and, during pregnancy, untreated hypothyroidism can increase the risk of complications such as miscarriages or premature births. 7. Mood swings. Mood swings are a lesser-known but significant symptom of hypothyroidism. Reduced thyroid function can directly affect the chemical balance of the brain, causing mood swings and even more serious conditions such as depression and anxiety. This is because thyroid hormones influence neurotransmitters such as serotonin, which regulate mood and emotions. People with hypothyroidism often report feeling more irritable, sad, or apathetic for no apparent reason. Depression, in particular, can develop or worsen due to the general slowing of the metabolism, which affects energy levels and the ability to cope with daily stress. Anxiety can also arise, bringing a constant feeling of worry or nervousness, even in normal situations. In addition, the lack of energy and extreme tiredness associated with hypothyroidism can worsen these mood swings, making daily activities more difficult to cope with. If you notice that you are more emotional, depressed, or anxious for no clear reason, and these feelings are persistent, this could be a sign that your thyroid is not working properly. 8. Swelling of the face. Swelling of the face is a common physical symptom of hypothyroidism caused by fluid retention and a slowdown in metabolism. When the thyroid isn't working properly, the body has more difficulty eliminating excess fluids, resulting in visible swelling, especially on the face. This swelling, known as myxedema, can give the face a puffy or puffy appearance, particularly around the eyes and cheeks. Some people may also notice that their features look heavier, or that their eyes are slightly closed due to the accumulation of fluids in the tissues. In addition to the face, swelling can occur in other parts of the body, such as the hands, feet, and ankles, but the face tends to be one of the most noticeable places. This symptom can be uncomfortable and also aesthetically displeasing, causing concern for many people. 9. Decreased heart rate. The thyroid plays an essential role in regulating metabolism and modulating cardiac function, including the rate at which the heart beats. When thyroid hormone production is below normal, the body's metabolism slows down, which also affects cardiac activity. People with hypothyroidism often experience a decrease in heart rate, known as bradycardia. This means that the heart beats slower than the normal average, which is usually between 60 and 100 beats per minute at rest. In some cases, the heart rate can drop to levels that can cause symptoms such as fatigue, dizziness, or even fainting. Bradycardia can be worrying, especially because in severe cases it can lead to more serious complications such as heart failure. In addition, a slow heart rate can result in an inadequate supply of oxygen and nutrients to the body's organs and tissues, affecting energy and the ability to carry out daily activities. 10. Memory difficulties. Insufficient production of thyroid hormones can affect brain function, resulting in cognitive problems, including difficulties with memory, concentration, and reasoning. People who experience these difficulties often describe a feeling of mental fog, or a difficulty in remembering simple information, such as names, appointments, or even everyday tasks. This can lead to frustration and stress, especially when cognitive difficulties interfere with work activities or social interactions. These memory problems can be particularly worrying, as they are often mistaken for normal aging or stress. However, if these difficulties appear suddenly or intensify, it could be a sign that the thyroid is not working as it should. In addition, the connection between hypothyroidism and memory problems can be a two-way street. Stress and anxiety, which are also common in hypothyroidism, can aggravate cognitive difficulties. Identifying the signs of hypothyroidism is key to ensuring that you receive the right treatment and improve your quality of life. If you recognize any of these symptoms in yourself or someone close to you, it is essential to seek the advice of a health professional. Remember that early diagnosis can make all the difference in managing this condition. What's more, by sharing this knowledge, you can help other people better understand the impact of hypothyroidism on their lives. If you enjoyed this video, don't forget to like it, subscribe to the channel, and share your experiences or questions in the comments below. Your health is important, and together, we can raise awareness about thyroid health. Thanks for watching, and see you in the next video.